One is a basic first aid, nursing, sales and exit preparation question. Are question from 33 to 37. Question number 33. A 29 years old now second trimester woman arrived your emergency department with a complaint of blue discoloration of the skin with saturation of 80%. After arrived 30 minutes of your emergency department, she lost her consciousness. During airway assessment, she have an obstruction. Based on the above case scenario, which choking management apply as a first line? A. 5 back slap. B. Chest thrust. C. Abdominal thrust. D. Heimlich maneuver. Question number 34. A 13-year-old female patient lie down on the ground in a community, notify a problem, call for an emergency center. After 15 minutes of healthcare professional arrive a scene area and start emergency assessment. A patient does not breathe but she have a weak pulse. As healthcare professional, which one is the best action? A. Begin CPR immediately. B. Check for blocking airway. C. Begin resecure breathing. D. Stop bleeding and immobilization. Question number 35. A nurse can perform emergency nursing care for the patient at emergency ward. The patient arrived emergency with open fracture with mild bleeding. She performed insert their hand to find or check any foreign body on the fracture area. She stopped bleeding by applying tourniquet, and she secured IV line for fluid administration. As a senior nurse, which action of fresh nurse is incorrect? A. Application of tourniquet. B. Application of IV secure. C. Application of fluid administration. D. Application of probing. Question number 36. Which pattern of fracture more common in children? A. Transverse. B. Oblique. C. Green stick. D. Spiral. These are the last question for basic first aid. Question number 37. A 7-year baby come to your emergency department with a complaint of malatine toxicity. When a baby arrives at emergency department, her vital sign is unstable, bradycardia, hypotension, and have excessive secretion. For this poisoning, which antidote is the best to prevent the patient's life? A. Adrenaline and normal saline. B. Atropine with ringer lactate. C. Gastric lavage and ringer lactate. D. Naloxone and normal saline. Next one is pediatric nursing. Question from 38 to 42. So pediatric nursing is a very important, attractive part of the nursing profession, to providing care for pediatrician. So question number 38. A new home delivery baby come to your emergency department after 2 days with a complaint of unable to pass stool. After a different imaging study, a disease is characterized by an absence of submucosal ganglionic cell. Based on the above data, can you suspect A. Imperforated anus, B. Colonic atresia, C. Calosia, D. hair-sparing disease? Question number 39. A 14-year-old male patient come to your emergency department with a complaint of sudden onset of fever with projectile vomiting and a severe neck pain. During physical examination, a patient have involuntary bilateral flexion of hip when healthcare professional perform simple flexion of the neck. This kind of meningeal irritation sign is A. Kerning sign, B. Nuchal rigidity, C. Brudisky sign, D. Scalar sign. Question number 40. A 12 years non-epileptic patient for the last 3 years under drug treatment come to urology facility with a complaint of easily fatigable with generalized body weakness and pale conjunctiva. Based on the above data, which anti-epileptic drug they cause this serious side effect? A. Carbamazepine, B. Valproic acid, C. Phenytoin, D. Phenobarbital. Question number 41. A 6 months baby, non-hydrocephalus patient, come to your emergency ward from Y Health Center with referral paper. During emergency physical examination, the fetal head produced cracked spot sign due to separation of suture. This clinical sign is McQueen sign, B. Soas sign, C. Sunset sign, D. Nuchal sign. The last question for pediatric nursing, question number 42. Most medical studies show provoked kind of seizure is more common in children. Her clinical characteristics are generalized, tonic-clonic. Which one is the most common cause or predisposing factor for this baby? A. Hypoglycemia, B. Fever, C. Hypernatremia, D. Diabetic ketoacidosis. Please put your answer on text.